name is Aretha, and welcome back to my channel. So today I wanted to have a discussion around choosing doctors. And the reason why I wanted to have this discussion is because I wanted to share something that I've learned through my journey. So I've had a couple general practitioners or family doctors. I've also had a few counselors, therapists, psychologists, psychiatrists, psychiatric nurses. I know, right? Like, there are so many, and how do you tell the difference? Like, I still am not really sure about the difference. All I know is that, like, I've seen everyone, and they're all different because I think it's just the way their approach is different. But even with family doctors, I've noticed that there has to be something there. There has to be a trust there. If you don't walk into your whomever doctor you're seeing, or counselor, therapist, whoever, if you don't walk into there feeling like they have your best interest at heart, or if you're saying something and they're just not understanding what you're saying, or their method is just not what you expected, or you just don't feel it, like, it's okay to look for someone else. I've seen counselors that I've been like, I went to one session and then realized I don't think I got anything out of it. Like, there was something that didn't mesh well with me, or something that I felt like I didn't get a good feeling out of the session, and I didn't feel like it was helping me in any way. So if that's the case, you could always look for someone new. And I don't think people tell you that. But if you've seen someone previously, you can probably contact them as well and see them. But really, you need to know how it works in your system. But even for me, even though they assigned me someone, I've went into meetings and like had one session and then really felt like I don't know what I got out of it, And I don't want to judge it by the first session, but so then I kept going a couple times and then realized, you know what, I'm not feeling this, and then decided to switch to someone else. Or if you're not feeling it, be like open. This is where the feeling comfortable and honest and open to talking to your doctors helps. Because if they're doing something that you're not 100% sure is working for you, you should feel comfortable enough to have those conversations. And if you're like me, I have to take time to build up that relationship with people. Anyone, whether it's my friends, my doctors, things like that. Like, I need time to say, okay, I trust you, So I'm not gonna go walk into anyone's office and be like, I trust you right away, because it just doesn't happen overnight for me. So it takes me time. But if I've come to a place where I realize, you know what, I don't feel comfortable sharing things with you, that's a problem. And I've even had doctors where I felt comfortable enough to share things with, and then I did, and then just their attitude towards what I said, like, just kind of was like, okay, that wasn't great. I was just bearing my soul to you, and now you just said that. So for me, it's like, okay, we're not a good fit. So I went on and moved on to someone else. And those are just family doctors. I think I talked about this before, but in my first couple years of mental health, I saw doctors who were like, you're gonna have to be on medication for the rest of your life, things like that. And I don't know if that was to scare me or what, but I was like, I don't want to be on medication for the rest of my life. Yes, I'm on medication now, but my hope is that medication for me is just the little crutch that I need to get past this moment. And so when I'm better and I feel confident again and my self-esteem is back and all those things, then I'm gonna, work with my family doctor and get off medication. And I have a family doctor that feels the same way. And sometimes you have to switch doctors just because they retire. I was with my other family doctor for a long, long time, and she saw me through a lot of things. She helped me get diagnosed with PCOS and things like that. And so, I was able to come into her office and just say, hey, so I'm having this issue and I don't know what it is. Can we check it out? And I could do that. I felt so comfortable with her. I could tell her anything. And so she was great. and then she retired. I was like, no. So of course I had to find another family doctor. And I found that going to websites like RateMD and things like that were really good for me to find my next family doctor. Only because, and I do read the comments, good and bad, because if I'm looking at the good and the bad, when I read the bad ones, I really try to be critical about what they're complaining about, right? Because sometimes you're just having a bad day and that's just what came out, because that's just their perspective. It doesn't mean those things are relevant, right? So for me, it was like, oh, okay, you know, it just might have been them and their personality. Who knows, right? So I do find that reading the feedback really important. And so even when I'm finding doctors for therapists and things like that, like I really want to know what their specialty is, what I want to work on, if they're there to help me. Because the other thing too is if you actually look at some of these websites, they actually have like ratings and then they have specialities. So like, what do they focus on? What are the things that they're most known for specializing in? Like one of them is like grief. I know, depression, anxiety. Like if they have a specialty in a certain area and I think that's the area that I need to work on in my life, then I'm probably going to choose those people over just someone who's just a therapist, a counselor, a psychiatrist. Right now I'm seeing a psychologist, and actually this is the first time I've seen a psychologist. I did see a psychologist previously when I was an outpatient at a hospital, but I only saw them once or twice, and then they basically handed me over to their psychiatric nurse, who then I did counseling with, and then they basically oversaw the nurse basically. And it really did work. It was really, really great. I really enjoyed it. I learned a lot of things. And actually, those are a lot of the tools that I'm probably going to be sharing with you that I learned during that time. That I not only am going to use this to share those tools with you because I found them very helpful, but reminding myself that I know these tools. Because sometimes it's been so long that I've had to use them that I forgot I knew them. And so I'm really going to be going back in my life and just remembering that I do know these tools. So yeah, so that's what I wanted to talk to you today, was that, you know, yes, number one, you need to know, you know, do your research, find out who your doctors are. You know, I think in the States, I think it works different because of their insurance system, because they only work with certain doctors or whatever. I mean, but just know those things. But if you know that you have at least a pool of who you can see, figure out who those people are, do your research, find out like, are these people that you think that you would want to use? For me, the best sessions that I have are the ones that counselors are listening to me and challenging my thinking, or getting me to think about the situation that I'm talking about in a different way. And not in a negative way, not like negatively saying like, oh, well, you know, just why are you thinking like that for? Of course you're gonna think that. You know, nothing like that. Just steering me gently into a way of saying, okay, that's great. Now, have you considered this? You know, things like that, and really challenging my thinking and making me think about the situation in a different way. But the whole time, I'm doing most of the talking. I find if I go and see people and they're talking all the time, why am I there? If I wanted to know their life story, I would be their counselor, I guess. I don't know. But for me, if they're talking most of the time and I'm sitting there listening, my attention span's already out the window. I need some other sort of stimulus or back and forth conversation. And so for me, I already know that that doesn't work for me. But I know that now because I've done, you know, I've gone through these experiences that have taught me these things. So now if I have to see a counselor or someone or think about things, I find it very helpful when I do most of the talking and I do a lot of self-reflection. So especially when I go see counselors or therapists and they give me homework. Now, there were times in the beginning where I didn't do well with doing homework. They would assign me homework and then I would go to my meetings or sessions or whatever, and I would have some of the things done, but not some of them because I just was like sleeping all day or something. But that's important too, right? Just saying, you know what, I didn't feel up to it. I didn't want to, I didn't do it. I didn't want to do it. I just wasn't in the mood to do it. That's important too, right? Like that's the whole process, because that's part of, I guess, the depression, right? You're in the situation where you just have no motivation to do anything, and them giving you homework sometime is like, I'll give it a shot, but really, I don't think this is gonna get done. But if they keep giving you homework and eventually you start making it a priority, that's part of the healing journey, is saying, okay, I've done my homework today. Okay, I'm gonna move forward. And so in the beginning, don't think of it as like a failure. Like, no, it's just a part of a process. They're giving you something, you didn't do it. Okay, awesome. Next time, maybe next week, maybe shoot for it. Set it as a goal. Maybe 3 weeks from now, you're gonna do your homework that they assign you, because I got homework all the time. And I specifically got homework around situations that were specific to myself. And I could only have those conversations by having real, authentic conversations with my counselor, therapist, whomever. So that's why I cannot stress enough that you need to feel so comfortable in their office to have those conversations. And just like, if you are not feeling it, like, express that. The sole focus is to get you better and back into society and being a contributing member. That's their sole focus. If you feel like their sole focus is not doing that, then find someone else. So yeah. So to recap, my recommendations are, from my personal experience, is do your research. Look who you can go see, what are their specialities, figure out what you think you need to work on, and then go see them. Number 2, really get comfortable and take time to get comfortable with them. But you need to be able to be very open and honest with them and not be afraid that what you say there is going to be used against you in a different way. Obviously, as health professionals, if you say anything like, I'm going to hurt myself, or I'm going to hurt another person, or someone else is in danger, they then have to break that confidentiality, because now safety is an issue, right? So I'm not saying don't tell them those things, but they're gonna work with you through those things about what that thought process is. Like, they're not gonna charge you or anything, like, just for having those thoughts, but they're at least aware of it. And if they feel that someone's in danger, they can do something about it. So really, again, their whole purpose is to get you into a place that you are a healthy, contributing member of society. So hurting yourself or hurting someone else is not gonna be that route. So they are going to help you with that. And my third recommendation is, if you don't feel like you can be open and honest, or you feel like they have your best interests in place, you can ask for someone else. This is supposed to be your health journey. Your therapist's office shouldn't be like a competitor kind of thing, like, oh, there's this person who's the top and this person, and they're competing over how many clients they can get. Like, it shouldn't be like that. Their overall focus should be on the health of their client and getting them into their best place for success. And if they can't do that, and if you feel that you're not in a place that can help you do that, then ask for someone else. You have to be very confident that you're getting the best help you can. And if you're not, you can always ask for someone else. And so those are my 3 recommendations when choosing doctors, psychologists, psychiatrists, therapists, counselors. I know, there's so many. But that is my mental health tool for today, is choosing the right doctor for you and making sure that the person you choose has your best interests at heart and will help you become your best self. So thank you for listening. I don't know what topic will be next week. I do have a couple of ideas, but some of them are going to take actual research, because I'm actually going to go through some of the things that I've learned and actually have like some more of a tip, because I do notice that I think the workshop that I took on how to say no was quite successful. So I want to see if I can do more of those things. And I do have topics that I want to do in the future, some of them being sleep hygiene. That was very important for me when I was going through periods of insomnia, which I've had on and off. And the other one is how self-esteem plays a part in depression and anxiety. So those are 2 topics that I want to talk about. Subscribe so you can get my other videos as well. And yeah, and comment if you have any questions. Like, did you find this helpful? Is there something that I talked about that you felt you agreed with, you disagreed with? Let me know in the comments below. And I will see you next week. Bye.